Summer is here, and to show off that rockin' bod, some of us, myself included, need a little bit of help. I'm here with Dr. Heather Rocheford, and she is a board-certified plastic surgeon, and we are going to talk about liposuction.
So liposuction is a very common procedure. It's actually very well tolerated. The best candidates for liposuction are patients that are of close to their ideal body weight, or they have been at a stable weight and they have areas that are diet and exercise resistant, or genetic areas, say the saddlebags or the flank, the muffin top that never goes away despite their best efforts. And so it's really for those isolated areas of body contouring that really you can't do anything about.
So there is such a thing as exercise resistant areas.
Absolutely. People genetically have fat deposits in different areas, and you can just look at, your family history and see where everybody from your mother to your aunts puts their fat, and everybody's got saddlebags, or everybody has flank fat or larger behinds. So there's genetically areas that people put fat that's hard to get rid of.
Yeah, no matter how much you hit the gym, no matter how much you walk, run, exercise. So how much weight can a person actually lose with liposuction?
Well, it's really not a procedure for weight loss, but generally what people will see on the scale after liposuction is maybe 3 to 5 pounds will be gone. Fat doesn't weigh very much, but it's the contour that really we're affecting.
Okay.
And then always the question is afterwards, well, if I liposuction an area, aren't I going to gain weight in just another spot? And really the answer to that is, if your weight stays the same, your contour is going to be the same. If you should go up a few pounds or down a few pounds, your contour will stay the same generally. You might notice that an area that you didn't used to gain weight, say the back of your arms or your tush, for example, might be a little more voluptuous if you gain a few pounds after liposuction, because what's happened is you have taken away a genetically primary storage of fat, so your body's going to say, okay, well, that area is gone, let me go to the next.
So you completely close off that area for fat storage?
Not completely, because there's still fat cells there. So so fat cells can grow basically as large as they want, sadly.
Unfortunately.
And they don't multiply unless you become morbidly obese, and then they can multiply. But a fat cell can grow. So even though I will take out as many fat cells as I can, the fat cells that are left still can enlarge if your calories in exceed your calories out.
Sure.
Yeah.
So what about like the back of the thighs and the butt? Does it get rid of the cellulite?
Good question.
Hail damage?
Yes, the hail damage. So generally with liposuction, cellulite is going to look better. We can't guarantee that. Cellulite sometimes will, depending on how much loose skin you have, sometimes cellulite will look a little worse if we take away too much fat.
Okay.
But generally it's going to look
because
better.
Why?
The reason is fat is a structure that's holding your skin.
Okay.
And if you have very loose skin and you take away the structure underneath, then you can create more dimpling and wrinkling.
Okay. And is there a procedure to fix that, like skin tightening?
Skin tightening can help, and that's something that we very commonly do. Say if we're going to liposuction the arms, we can do skin tightening afterwards to help with the skin, the laxity of the skin, and that works very well. In some cases, especially if a patient is older or if it just has genetically looser skin, then we can do a skin removal procedure, such as a thigh lift or a tummy tuck, things like that. But mostly, patients that are candidates for liposuction are patients that have good, tight, firm skin that's going to redrape. That's what you want, is the skin just to redrape without having to do an additional procedure.
Right.
And so that's something that you would talk about with your plastic surgeon. Is it better for me to do liposuction, or should I do a tummy tuck instead?
Okay, so what about any other alternatives to liposuction? You see the cool sculpting, and you see all these other, non-invasive forms. How do they compare to liposuction as far as results?
In terms of results, with liposuction, I know liposuction works. It's a very reliable procedure in terms of fat removal. With cool sculpting, you're relying on, first of all, freezing the fat, and then your body actually has to remove all those dead fat cells. So there's a period of inflammation that can be as long as 3 months, and it doesn't always work. With liposuction, a fat cell that I've removed is gone.
It's gone.
And so, so I find the procedure more reliable, and there's not as long a period of inflammation afterwards, and we're not relying on the body to take away something. I've already taken it away.
So what's a realistic expectation after the procedure as far as recovery and pain?
Most people are on pain medication for 3 to 5 days. Most people can go back to work at a week's time. You may still need to take a pain pill at night to get comfortable sleeping, but most people are able to go back to work at a week's time. You're going to be tired for the first 4 weeks after surgery, and that's just because even though your body looks great, you have tiny little incisions, there's still a bigger injury inside that's healing, and all your extra energy is being directed towards that to heal it. So probably about 4 weeks that you're tired, you can get back to exercise at 2 weeks. So most people are pretty eager to get back to their exercise regimen.
Or like me, who does not have an exercise regimen. So as far as the contour, is your body, do you get the contour right away? You know, like you said with cool sculpting, it's 3 to 5 months maybe that you're swollen, or 3 months or whatever.
Yes.
How soon do you get your contour with liposuction?
With liposuction, you're going to see the results right away, but because you have had a surgical procedure, you're going to be wearing a compression garment for 6 weeks. So the first 2 weeks you'll wear that garment full time, and for the final 4 weeks you'll wear that garment just during the daytime. And so usually by 6 weeks you're going to see your result, and you're going to have minimal swelling at that time. Some areas swell longer than others. The abdomen tends to swell longer than the thighs, but you'll see a result right away.
What's this compression garment look like?
It's like a girdle.
Okay.
So Spanx.
It's from the, okay.
And it depends on the areas that
Spanx.
it depends on the areas treated. So if you have the inner and outer thighs, it's going to be just like Spanx, the biker shorts. If you do higher up the waist, the abdomen, then it's going to come up higher like a girdle.
Okay. Thank you so much, Dr. Heather Rocheford.
Thank you.
Dr. Heather Rocheford, Rocheford Plastic Surgery.